The name of my presentation is Healthy Buildings, Center of Excellence, National Isolation Unit in Kigali in Rwanda. And some few information about myself. So thank you, Eva. You have done a great introduction, but maybe like 2, 3 slides from Braunschweig, as hopefully everybody knows the city. They have a big technical university. We are, as an institute, at the Department of Architecture, and we see us as a central teaching and research center for healthcare architecture in Germany. And we are very much into exchange with national and international research institution, clinical operator, planners, of course, and company in the healthcare industry. So we try to connect academia and not academia in this field. So here a little view on the central campus that you can really see where we are. It's historically, and this is also the next slide, we are very proud of our campus because historically, after the Second World War, it was all more or less newly rebuilt, and also now historically is it all under protection. You see some major historical buildings like the Forumsplatz from Wilhelm Krämer, and also from Dieter Oesterlin, the Okerhochhaus. So we have really 60s and 70s or 50s to 70s major architecture, pieces of architecture. So you're really welcome to visit this site, and also quite updated from the 2 years ago. We also have the Studierendenhaus with a lot of architectural prizes. It's a really nice also piece of architecture. So we try to build a bridge between like our, let's say, buildings of the 50s to nowadays. But coming to our project, what I would like to present, the Center of Excellence, and that is also that shows more or less also the partners of this project. It is supported by the German Ministry of Health within the program of GAP. And we are a very interdisciplinary team of those partners. You see a lot of logos. I will come back in 2, 3 slides, and I will just now show you the objectives, the partners, and the project process of it. So we have 2 major goals within our project. It is to strengthen the Rwandan healthcare system with regards to high consequences infectious diseases, HCID, through one is the major goal to construct a so-called high-level isolation unit in the capital of Rwanda, and as well of making a concept and to realize a training program for healthcare workers within this high-level isolation unit. So you see there the 2 fields are really coming together, and from my side, of course, as an architect and as a planner, of course, I will show the planning and the construction of this high-level isolation unit. Currently involved within this project, and that gives a really interdisciplinary or transdisciplinary approach within this project. We have the Robert Koch Institute as the project leader, us as the construction lead of the National Isolation Unit. We have on the Rwandan side the Rwandan Biomedical Center, RBC, as a counterpart of the Robert Koch Institute. We have the Rwandan Housing Authority, who is monitoring the whole project from the authority side. We have EACON, which is the partner architect's office in Rwanda, and they are supervising, they are consulting in all matters of planning on the regional aspect. And also within this kind of like a construction consortium, we have a contractor, Hyderabad, we have a structure engineer, we have a consultant, GOPA, specialized for IPC and MEP details, and we have Novalink, who are doing a detailed design for negative pressure ventilation system in our project. So you see we have a wide range of project partners on the construction. And as you see at the beginning, we have, of course, partners from the Charité University Hospital who are very much into the training aspect on the field of ICU level. And we have the Würzburg Medmisio Institute who are very much into training aspects. So from our side, project status, and I go through this, is of course in the way of construction. We have done a need assessment at the beginning. Then we have done a building concept, how to do this in a kind of like layout. The next step is the architectural design, transferring it into plans in layout. Then, of course, as everybody here also in Germany needs a planning building permission. So this was one next step. Tender process, that means to get companies giving their offer to build it up, and then detailed design, and then the construction itself. And today I will show a lot about the detailed design and the construction where we are now. The timeline, we have started this project in 2021. Then in May to November 23, we followed on with the tendering process. In December 23, the start of the construction site began, and at the end of this year, planning completion of the construction site and the handover to use it as a building. So the next question is why we are doing this, where we are, what, who, and how. So basic information about the project. So we are in Rwanda, and this gives a little perspective where we are. So we are very much in the center or the heart of the African continent. It's a very, very little country in regards to the size of whole Africa. And to kind of like compare it with Germany, it has more or less the size of Hessen or maybe of Belgium as a neighbor country of Germany. And it is very divided in the city or capital city of Kigali, which is in the center of this country. We have a lot of like urban rural areas with a lot of nature, with a lot of different nature perspectives. This gives you a little like view of a typical like image of Rwanda, which combines the forest, the jungle, and on the other side it is very much with volcanoes. So we have also Volcano National Park, and in the center you see a gorilla sitting. So this is also very famous, the gorillas who are living in one of the national parks that are very famous for the country. A lot of tourists are coming to Rwanda to see the gorillas, the bear gorillas in this national park. This gives a picture of Kigali. It's a very livable, very big city of 2 million people. Rwanda is a very growing, stable country. So this is a really modern capital, very clean and very well organized to be honest for comparing to neighbor countries. And historical wise, this is also that I want to show on one slide, of course, the genocide that was at the end of the 90s, where there was a big conflict between the two ethnic groups of Hutus and Tutsi, where there were nearly 1 million people were killed in 3 months' time. And this is a very, very important historical point in the society of Rwanda. And I won't go too much deeper in here, but I think this is something that is very important if we are talking about Rwanda and about the society and the history. So why we are doing it? So why is a special isolation ward being built in Rwanda, and what expertise can German clinicians and planners contribute to the project? So the Current situation and the requirements in Rwanda are as follows. Rwanda is considered as a high-risk area for HCNID outbreaks. So we have currently recurring outbreaks in neighboring countries, for example, in the Dominican Republic of Congo. And at the end of 2024, there was also an outbreak of Marburg virus in Rwanda itself. So they're really facing quite often outbreaks for high-risk areas. They have a good management, but little expertise in the care and treatment of patients of HCIDs. So there's no specific training or further education in the field of special isolation. Prior EFO, and EFO is this program that was built from RKI in the last 10 years. So there's no expertise on the academia. So this is very important. There's a high need for further training also in the field of intensive care. So to keep it, there's a general capacity of intensive care beds that is low. So we have approximately 30 beds for about 12 million people in Rwanda. And there's a relatively stable political situation in Rwanda itself. What is the contribution from German partners? One is the expertise and the treatment of the Center for Disease Causes by Highly Pathogenic Pathogens, so the STARCOP Center that is organized also, or where the partner RKI is very much involved. So we have the 7 highly specialized advanced centers in Germany who gives within this project their expertise. There's little direct practical expertise from Germany itself. And medical and nursing staff is involved, some of whom have field expertise from other countries. So that is coming from RKI and also from Charité with this expertise. EFO itself has a training course in Africa 2014, so then more than 10 years now, and expertise, of course, we are bringing in the field of ICU medicine and also expertise in the healthcare construction and building isolation from our side, from the TU Braunschweig. So coming to the location, so where is the COE located? What location factors had been taken into account and which neighboring organization is linked to the COE? And there I would like to show you a map of Kigali, and you see 3 main locations. One is the city center on the left-hand side. Then you see on the right-hand side the airport. And the little violet point is where the location of the isolation unit is. It's a new Kigali healthy city, what is being built up. Quite, let's say, about 1 hour, 45 minutes from the city center by car. And here you see the location itself, and I go to some major points. You see on the right-hand side, if you see my little arrow, at the moment on-running district hospital of Masaka and the major street that access this district hospital. And in the last 10 years or like 7 years, there was massive infrastructure project being built up. So we have the Cherche UK, which is the university clinic of Kigali, which is built up around this Masaka district hospital. Don't ask me why they have a district hospital next to a university hospital, but it's a very special situation. But this Cherche UK is being built up by Chinese and invested by Chinese government. So maybe they have this kind of like basic information that they got this plot here. And then we have other stone keys. That is the heart center. On the left-hand side, we have the EARCAP, the yellow one, which is the Center of Excellence in Minimal Invasive Surgery. and we have a laboratory that will be built in the next 2 years, funded by the GIZ, and us, as our isolation unit is the blue one, is located here below the new hospital, University Clinic, and be accessed by two ways, one by the main street on the top and by another street which will be built up on the lower side. Location factors, which are quite important for us as architects. We have a very high slope on the side of approximately 20 to 30 degrees. That means the plot on the length is 130, 140 meters, and we have a high distance of about 35 to 40 meters. So Rwanda is a country of hills, so there's not a lot of flat land. So of course we have a slope here, and that gives a lot of challenges regarding access, regarding placement of the buildings. Local factors, as I said, is the large university clinic, construction site direct on the hillside above. There's no access road has been built yet, and narrow plot of land. So it is very length, but it's very narrow. So we have also this as a challenge. And we have on the lower part wetlands, so there's a natural reserve in the valley, which is also quite important. So what is a special isolation ward and what is happening there? This is also a very important point. So patient care in a special isolation unit is that we have a total of 10 single bedrooms plus one training room. Cross-contamination between patients must be prevented. So this is a very high factor. Very high staff to patient ratio when caring for HCID patient, and training rooms identify in design to patient rooms. So train as you fight. So then we have isolation plus care and also isolation plus treatment. So HCID patient often requires intensive care treatment, and we have a high risk of infection for staff during treatment procedures. So this is also a very important thing that we have to take into account, that there has to be a lot of security and preparedness. Care and treatment in the patient rooms. The patient remains in their rooms for the entire stay, and there may be results in some restriction on the treatment options available. So special protection measures we have. One is within the treatment of the staff, they need PPE, so personal protective equipment. We need for all the procedures, training and standard operational procedures, so-called SOPs. Also very important is the area management. Area management means what are green and red areas in regards to security. We have, of course, materials on component joints. So the factor of cleaning and disinfection is very important. Building services is very important in regards that everything is working, from waste management to the ventilation and so on. We have a lot of material logistics, so clean and unclean materials, consumables, medicine equipment, and so on. Waste management, as I said, and the question of handling of dead bodies. More or less in this presentation, because it regards to construction. Here one slide that you can see how it is working in PPE. It's a very intense working environment. You can work in this PPE maximum 1 to 2 hours. You have a very intensive decon and process after you have done your work. So this is very important. There's a quite high staffing key. So we have like 20 staff members for one patient a day. So this is also quite important also in this local context. There must be always at least two people with the patient, partly for their own protection. Also, this is a high staff quote, and it's also cost-wise that a PPE, depending on the model, but at least 100 euros is one PPE as package. So who are the future users of the COE and what are the requirements? Also a very important question for us as we have done this in our assessment. So we see as user groups on the one hand side the staff, but also the staff in the following areas: the medical staff, the cleaning staff, we have logistics, we have technical, so craftsmen, for example, and we have administration staff. One other user group, of course, are the patient itself, but also we have visitors. Visitors is a high factor because there's a high need that people would see their relatives very much also when they are in isolation units. So that was a high uh, requirement also from the Rwandan side that we should introduce visitors. And we have as a last user group the external clinical staff, so the trainees. So for us, it was really important to bring the knowledge from the German side and from the Rwandan side to get an idea what is important to plan isolation unit so that it has a very local context, but also to give knowledge from the German part. So we have a review of existing training programs and SOPs from both sides. The definition of the level of care and treatment based on the future staffing levels and current training staff. So the question was really, what is really the use of this building? What is it in peacetime and what is it in pandemic times? Then the definition of possible scenarios and the resulting user group specific processes. So really the question how the floating is within the building. And of course, the question, how do we communicate? What kind of tools are we using to easily get an understanding how to transport knowledge for training staff on both sides, on the medical and non-medical parts? So we as architects, what we have done is we divided those groups by patient, by staff, visitors, and so on. And then we made like so-called ideotypical floating through the building. So we said, okay, how do a patient enter the site and the building? What are they doing within the building and how do they exit the building so that we get a really understanding of the activities of the rooms and the requirements of those rooms. And that was really important because it really shows and it gives a good graphic for the Rwandan partners, but also for the German partners, for the planners and the medical partners to get an understanding. So this is an example for the patient flow. So we started with the street saying, okay, how is the patient coming to our site? It is coming by ambulance, so no other way. So they will transport directly to their patient rooms. So they are not going through the building. So they're staying the whole time of the length in the patient room. And then when they are leaving the patient room, there are three scenarios. One is the patient recovers. One is they still need additional treatment or the patient dies. So, and that gives us also the idea how the flow of those three scenarios goes on. So we have a decon room to leave the patient to the street or to transfer to the hospital or to decon and to bring this patient to the morgue and then leave it. So this, and then we can also see green and red dots to really relocate red and green areas. So that was really important for us to get a deeper understanding of the different user groups. So coming to the layout, so how does the Center of Excellence work, and how can the risk of transmission of pathogens can be minimized as much as possible? And here you see the layout of the patient area, and that gives us hopefully a quite clear impression how that building works. So we have a circular one-story building where there are the 10 isolation patient rooms and one training room. And then we have a cube, a square, where the staff will be entering the site and will be changing their clothes and are going to the decon and to the necessary rooms that are needed for the patient treatment. You see also all patient rooms has the same site, has the same enter room in front, and have a bathroom and a little entrance to the surrounded area, to the street. And we have a centralized in the middle, quite spacious logistic area where they can do a lot of like preparation to enter the room. And then we have at the center here the staff control room to really overview the whole treatment of patients. Here you see on a higher level the patient room itself, as I said, with the enter room in front, with the patient room and the bathroom, and the size of the patient room complies with German regulation regarding the minimum size of an intensive care room. So we really try to figure out what space does the patient and the staff needed to be treated in this room. Coming up to the question, how is it treated in two different scenarios, what we are calling for those HCID patients. So here you see we have a complete red area within the center with the enter room and the patient rooms. So that means we have that every single patient room has a patient with the same pathogen, so with the same infection. So we can centralize the doffing and donning. You see the yellow or the yellow areas centralized, so they will change their clothes here, getting their PPE on, and then they are working with the same patient in every room, and then they will change their clothes and leave the red area through this room. This here on the left-hand side is a screen because this is a training room all the time. So we have an additional donning and doffing training room, and they can rather enter the room by the center or from the exterior. It depends on the infection scenario. And here the second scenario is if we have patients with different diseases, so that we can have a decentralized donning and doffing by using the enter room in front. So that means that the patient will stay, of course, in the room, but the preparation for the staff will be decentralized from the patient room, from the enter room. Here some major areas, as I said, the patient room with the visitor areas in front of the patient rooms, the donning and doffing, the training areas, and also you see the locker rooms and the storage rooms. And here you see the main flow of the user groups. You see that the staff is going through donning and doffing, as I said, and going to the patient room and bringing the dirty materials to this part here where there is a logistic area on a lower level in front of this patient room. And then we have on the other side the patient who are coming from the exterior going into the patient rooms. And then we have the training staff that are going through the training, donning and doffing to the training room. On the level above, and here you see the folded roof of the patient room, we have the centralized reception room for the staff so they can enter and go downstairs or above. And we have the reception area for the visitors. So visitors are coming to the site, can wait in this waiting area and can go down to the patient rooms by using the stairs. And I hope you can see it, the staircase on the right and the left-hand side. So they can organize by the Center of Excellence the visiting hours and also by looking if there is a case of an emergency event, so then they are not able to access to their relatives, so they have to stay in the visitor room. And one level above, we have the training area with seminars, with offices and training lounge, and we have the plant room for technical equipment for the mechanical ventilation. And here some sections through the building. You see this 3-story cube with the changing rooms on the lower level with donning and doffing, then the access point, the reception area above, and on the top floor, the training and the office area, and then in front, the circle with the patient rooms with this folded roof. And you see also the slope of the building from above here, and it goes down here to the logistic yard even further down. You see this on this whole length of this on this plot that we really have to see where we are placing not only the building itself but also the incinerator, the waste management buildings, water treatment on this whole plot, and also the whole kind of like roads that are necessary to bring or to put stuff away on this plot. Architecture-wise, we defined the 2 different building types in different forms. So we have the cube with bricks on the one hand side, which are completely red colored, and we have the patient rooms with painted in white surfaces of the facade and with a folded roof, so that staff and visitors can really easily divide this building in the 2 main functional parts. And here, this is a 3D animation that gives a view on a patient room below. So you see there's a terrace and covered with a roof and also with a folded roof that an ambulance can park directly in front of the patient room to bring the patient inside. And then we have the access on the right-hand side for the visitors who can go to the room of their relatives. And also the folded roof is quite a good way to have, on the one hand side, natural ventilation through the building, but also, and I can show you later on some pictures of the construction site, how the whole kind of like installation for ventilation, but also for water, for chlorine, can be installed on top of the patient area. Here, factors affecting the material selection, also this. I go very much fast through this because it's very much into planning, but you see MEP systems are very important for this isolation unit. We are needing chlorine solution for the piping system. We need wastewater treatment plants with decontamination process, also very important. Medical gases, oxygen, compressed air, and vacuum, which is a quite big challenge in this regional of Rwanda with their expertise. Also osmosis water system and vacuum system. And here some impressions of our planning of the patient room. You see, as ICU standard, we have a lot of medical equipment, a lot of treatments at the for surgery and for the equipment. We have a window always between the patient rooms so that the staff can orientate and have a look to the neighbor patient rooms. So this is very important here, and this gives a very technical impression of the whole negative pressure ventilation system, which HEPA filters. So we have really to see how is natural air coming to the patient, how we can make an under pressure within the patient rooms, and how we can get rid of the used air. So also this is for us a very high approach, also with our Rwandan partners, because there's no experience in this field, in this region. So we have to find a solution that is easily understandable, but also easily to maintain and to change different components of this negative pressure ventilation system. I'm just showing some, 1 minute goes through some impression of the site here that you can see. This is 4 months ago, those pictures showing the different current situation of the plot. Here, the patient room area with the centralized, a lot of workers, much more in Germany, who are doing the concrete work and yeah, the whole process is very interesting to see as an architect, of course, how it's very different to the German regulations. Yeah, and here also the facade of the facing slips of the bricks were covering the building, and here an interior view of the centralized staircase. So here a picture of the patient room with a window, as I said before, and here you see the whole slope of this area. Next steps, very shortly, end of 2026. So this year it will be completed, it will be handed over, and then the whole training programs of medical and non-medical academia will be started. So thank you very much. I'm sorry to a bit overlap the time, but yeah, thanks a lot.